Hi, I'm Sean Sinclair. I've been investigating ethical issues in health policy since 2013. I'm fresh out of a project analysing public debates about public health, and now I'm excited to introduce this short course which I lead. It's a course about distributive justice in health policy. So it's about the ethics of health policy, and particularly it's about rationing decisions and decisions about who to prioritise, for example, which patient groups to prioritise. The course could be really helpful for policymakers who have to actually make these rationing decisions, and for healthcare professionals who have to live with these decisions and implement them and explain them to patients, and maybe patients themselves, and then also public health people who also have to make decisions about priorities in their domain of policy. The module is about the fair allocation of healthcare and health resources. We have to say no to some people, and the question then is how are we going to work out who's going to lose out, and more important, how are we going to justify our decision to the people who lose out. And to do that, you need clear principles, clear defensible principles. So we're going to basically try and work out what those principles are. And it's a very contentious area. You've got people arguing on both sides of the debate. So, for example, on one side you've got John Rawls, who says we should always be concerned with the worst off, and therefore, for example, tax-funded healthcare is okay. On the other side of the debate, you've got Robert Nozick, who says it's wrong to threaten people with jail, for example, to force them to contribute to other people's welfare, and therefore tax-funded healthcare is not okay. So they're the sort of big principles. We're also going to look at more nitty-gritty policy questions. For example, should we prioritise younger patients over older patients? Should we take account of people's responsibilities? Some people live risky lifestyles, and should we take account of that in deciding who should get priority? So it's going to be quite challenging intellectually, but the outcome should be that you pick up some useful arguments when you're engaged in debates about these questions with colleagues or policymakers or whoever. The course lasts 4 weeks, but then you get another 4 weeks to write up your essay. You'll be reading academic literature. You'll be interacting with fellow participants on the course in the discussion forums, and then you'll be writing up this final essay on distributive justice in health policy. You can do the course part-time while you're working, but you'll need to clear your diary for the period because you'll need plenty of time for the reading and writing. The main part of the assessment will be an essay. You can choose your essay question from a set list, or you can make up your own question and then agree it with me, the module leader. And then the main part of the assessment will be your ability to understand the arguments on each side of the debate that you've chosen to write about. State the arguments clearly and then respond to them with commentary of your own. The course does count towards some other qualifications. So, for example, we have Masters in Biomedical and Healthcare Ethics, and this short course is actually one of the modules from that Masters course. So if you decide to go on and do a Masters, then this course will count towards that as a credit. And by the way, also, we have a postgraduate certificate and a postgraduate diploma. So if you're not ready to take on a full Masters, this course will also count as a credit towards those. If you want to book yourself onto the course, you'll see a link to the course page underneath this video. So click through to the course page and then you'll find a Book Now button, and just click on that and it will take you through the process.